I will go ahead and introduce the amazing Lisa Lapointe. Lisa was the British Columbia Chief Coroner from 2011 to 24, and she was a star among those who have held that position in the past and quite possibly into the future. She may have retired from that position, but I can assure you Lisa has not retired. Among the many notable achievements and positions that Lisa had during this time, for us, the most important and celebrated is her stance, her knowledge, and her compassion in regard to the toxic drug crisis and the drug harms here in British Columbia and beyond. Lisa has stood by us in our advocacy and has attended our actions, spoken at our vigils to honor our lost loved ones. She has spoken publicly in support of the lives of people who use drugs, often taking much criticism from members of the government and the public for her stance on legal regulated supply of substances. Lisa knows what we know, that saving lives is paramount. A quote from Lisa: "It is really disturbing that our politicians who we rely on to keep us safe are more likely to respond to ideological arguments than science." Lisa's positions have always been backed by solid research and evidence. Lisa knows from the top down the dynamics of politicians and the government in general as they create a shambles of drug policy. She has fought for evidence-based ways forward and has fought against the lies and misinformation of those who would not value the lives of our loved ones. I am proud to know Lisa Lapointe, to call her a friend and an ally, and I am so honored that she will open our 2025 AGM. So I hand it over to you, my friend Lisa Lapointe.
Thank you so much, Leslie. And I don't know if you want to change the view. That's a great picture of me. It's very old, and I have to update it, but I've been reluctant to. Thank you so much. I'm really honored to be here. I have such respect for the commitment and goals of your membership and your dedication to speaking truth to power and your advocacy for the people that you love. Thank you, Susie, for that, opening us in such a good way. And to Tracy, Leslie, Ruth, Jay Stewart, all of you who are so involved in this work. It's so incredibly important. And I am so in awe of your voices and the respect that Canadian people have for your organization. I want to acknowledge with humility that I'm here today from the traditional and unceded territories of the Wasanich people, represented by the Sartlet, Pakachin, Sycam, and Sayoc First Nations. And I know that most of you attending today are impacted in a very personal way by substances. Many of you have lost someone you love to drug toxicity or are living with the challenges of loving someone who is drug dependent. And to you, I extend my heartfelt wishes for peace and strength and my sincere thanks. Joining Moms Stop the Harm and participating in its activities, including this meeting, is a demonstration of your commitment to addressing one of the most wicked and devastating crises our country is facing. And so over the next 30 minutes or so, I'm not going to do a PowerPoint. I always fear glitches, and so I've prepared some remarks, and I think it's really, really important right now in an age of so much misinformation and intentional misleading information that we talk about what we know and that we're really clear on the facts, particularly the facts of this crisis. So I'm going to give a very high level overview of where we are and talk about some of the measures that our country can take to finally end this crisis and the threats to our loved ones. You'll notice that I use a variety of terms interchangeably. I use the terms illicit, illegal, and unregulated when talking about basically the street supply of drugs. And really that refers to drugs that are obtained unlawfully and they're unregulated rather than from an authorized source. And sometimes people use the term hard drugs. I'm not sure exactly what that means. All psychoactive substances, including alcohol, those that are regulated and unregulated, prescribed or purchased legally or illegally, have the potential to cause harm. I don't see a difference between something called a hard drug, except potentially it's the regulation, of course. And rather than the term overdose, I use the words drug toxicity or toxic drug event or drug poisoning. Um, in my role as chief coroner, we heard loud and clear from families that they found the term overdose very offensive. It suggested that their loved one took too much. And if they had just taken more care, perhaps they wouldn't have suffered the harm. And of course, we know that's not true. We know that the substances that are being sold in the illicit market today are so unpredictable and so toxic, it's virtually impossible for somebody to use safely. And I will never use the word addict. I hate that word. It has been used to vilify and stigmatize people. It's dehumanizing. It removes the person. And so, what I will say, and what in my role as chief coroner, we use this language across the coroner service. A person with an opioid dependency, or a person who uses substances, or a person with opioid use disorder. Whether or not people use drugs does not define them. We are people first. From 2016 to the end of September 2024, which is the latest data available on Canada's website, more than 50,000 Canadians died as a result of opioid-related toxicity. Most of those deaths were related to illicit fentanyl and other highly potent substances. And just as a note, because I have always found this really interesting and tragic, slightly over 38,000 people died of COVID. So we know the efforts that were extended by our governments in response to the COVID epidemic, which took slightly more than 38,000 members of our communities, and more than 50,000 people have died of drug toxicity. Illicit fentanyl entered the illegal drug market in about 2012. And I think you all know fentanyl is a powerful synthetic opioid, about 20 to 40 times more potent than heroin, relatively inexpensive to create from chemical precursors, unlike heroin, which is derived from the cultivation of poppy plants, so which requires growing and harvesting. And illicit fentanyl is created in drug labs, of course, with dubious control for quality and dosage. Because it is so potent, smaller amounts of fentanyl can be trafficked, making it harder to detect. And the potency also makes illicit fentanyl, of course, extremely dangerous, as the difference between 1 or 2 grains in its production can be the difference between life and death for the person using it. And while some people do seek to use fentanyl, others use it inadvertently when the substance that they intended to use, oftentimes cocaine or methamphetamines, is contaminated with fentanyl during production. I have seen drug labs in my work as a coroner. They are not labs by any stretch of the imagination. They are chaotic kitchen counters, basements. It is no surprise to me that the product that they create is so chaotic and so dangerous. People also die from other unregulated drugs where fentanyl isn't involved, and those include stimulants, like the ones I mentioned, cocaine and methamphetamine, MDMA, which is ecstasy. In BC, as in most other provinces and territories in Canada, virtually all drug toxicity deaths involve more than one substance, with fentanyl being the most present, most prevalent. People of all ages and all walks of life and from all neighborhoods in our country die as a result of drug toxicity, but most deaths occur in males between the ages of 30 and 39. That is the highest risk group of our community members. And research in BC shows us that most deaths occur while people are alone. And we know that people use alone because of stigma and shame and fear. And while many of those who die from drug toxicity have a diagnosed opioid use disorder or a drug dependency, many others who died used substances less regularly or only occasionally. And in fact, those most at risk of dying from fentanyl are those who are opioid naive, who do not use opioids regularly and have not built up any tolerance to it. And for them, a single fentanyl use can be fatal. The reasons why people use drugs are complex. Young people may use substances on a recreational or experimental basis. Sometimes people who begin using drugs recreationally find that the drug provides a feeling of relief or satisfaction that they've never experienced before. Others use drugs as a way of coping with pain or trauma, sometimes physical, sometimes emotional. And drug use often feels an unconscious need. And when a person develops a drug dependency, it is not a choice. It doesn't mean the person is weak or of bad character or any of the other myriad stereotypes used to malign people who use drugs. Substance dependency is a complex medical situation that comprises both a physical and a psychological need. We have a number of measures in Canada that can reduce the risks of serious harm and death for those who use substances. I want to talk about some of those. Supervised consumption sites have been demonstrably incredibly effective at saving lives. They are safe, clean places where people can use their own drugs with medical support nearby if they suffer an adverse effect. Government of Canada data shows that there were more than 3 million visits to supervised consumption sites in Canada from March 2020 to February 2025. Slightly more than 48,000 overdose events occurred. That's language from the Government of Canada website. And 19,000 required the use of naloxone. But most astounding, there was not one fatal overdose of 3 million visits. There are those who say that safe consumption sites enable or encourage drug use and who think they should be closed. Closing a safe consumption site does not mean people will not use drugs. It means that the risk of serious harm to those people has just risen dramatically. People don't use drugs because they have access to a safe consumption site. That's nonsensical, frankly, and honestly would be laughable if it didn't have such tragic results for members of our communities. Safe consumption sites save lives. It can also be a path to people to make connections, which is so incredibly important, to find supports and to initiate a way out of drug dependency. And drug checking services, also incredibly valuable, incredibly important, where people can test their drugs to see what's present in them, not nearly as widely accessible as they should be or could be. And I want to talk about treatment. We hear from many of our politicians that treatment is going to be the sort of the gold key to get us out of this crisis. And certainly treatment needs to be available. It needs to be accessible. It needs to be free. And what we have currently is there are a number of things around substance use treatment. So we have the prescribing of opioid agonist treatment, methadone, Suboxone, and that's very, very effective for many people, all the way to residential treatment based on an abstinence model. Treatment of substance dependency is complex. Opioid agonist treatment is an evidence-based treatment, helps reduce withdrawal symptoms and cravings, and can be provided in parallel with other harm reduction interventions, including addressing the psychosocial factors that face individuals who are using substances. Residential treatment is typically 60 to 90 days of live-in intensive treatment that includes counseling and other programs. In BC, I suspect it's the same in the rest of the country, most provincially licensed facilities will accept clients receiving opioid agonist treatment. However, many private, and these are the for-profit treatment centers, aim for abstinence as a goal, and they will not admit anybody who's on opioid agonist treatment therapies. Abstinence is complex. A person's opioid tolerance can be reduced in as little as 3 days. So those who have been abstinent for a period of time and then use opioids are at greater risk of experiencing drug toxicity harms, including death. In BC and across Canada, and this is still astounding to me, and a recommendation the coroner service made many years ago, there is no publicly available data that shows the number of people who have completed treatment for substance use disorder and their outcomes, both short and long term. So we are facing what I believe is the most wicked public health emergency our country has ever experienced. And we just don't have the data nationally around what is effective in helping people to wellness. And that is a shocking absence. We simply don't know how effective treatment is and for how long, or what percentage of people who stop using drugs can remain abstinent. The data just doesn't exist. Anecdotally, I know that in my 13 years as chief coroner, many of those who died had completed treatment or been through residential treatment a number of times and died after a period of abstinence. It is a dangerous time, and we don't have the supports that people need to support them long term, that continuum of care. There are quite a few people in our country, and sadly, some of them have a very public voice, who think that substance dependency can be fixed with treatment, like you'd repair a broken arm. And of course, it's not that simple. Substance dependency is often described as a chronic, relapsing disease. It is not like mending a bone. And people with lived experience tell us that recovery is a daily event. If someone relapses then on the recovery journey, it's not a failure. It's part of the process, and hopefully they will find the supports to return to recovery. Moving away from drug use may require many years of pharmaceutical support, along with measures to address additional and often complex physical and/or mental health issues people are experiencing. This is described, as I mentioned, as a continuum of care, meeting people where they're at and providing all of the tools we can to help them to wellness. Not one over another, not an either or, but every tool that we have across the country to keep people safe and help them be well. We know that substance dependency is complex. We know that treatment is not straightforward and that recovery is a journey. We have little data on abstinence following treatment. We know that far too many of our loved ones continue to be harmed and continue to die. In BC, in 2021, after much advocacy, the government introduced a policy in support of safer supply. Safer supply is the provision of regulated pharmaceutical drugs to those at risk of death or serious harm from illicit drugs. It does not encourage or promote drug use, as critics will say, but recognizes the complexity of substance dependency and focuses on reducing or removing people's reliance on the increasingly toxic illicit market, which is, by the way, totally and continually focused on profit and expansion. And I find it astounding that so many of those who are adamantly opposed to safer supply or pharmaceutical alternatives, as we often refer to it, are also those who are adamant law and order advocates, not recognizing that if you don't support safer supply or pharmaceutical alternatives, you are supporting the illicit drug trade. We are supporting the continued billions of dollars of profits that drug trade racks in. So safer supply, as I mentioned, also known as pharmaceutical alternatives, ensures that people can access the drugs on which they're dependent safely. Safer supply programs also provide people with a place of connection, compassion, medical support, and mental health supports. And there are a number of pilots. The Government of Canada has funded 10 safer supply pilot projects in Canada, where participants receive safer supply via prescription by a physician. In BC, it can also be a nurse practitioner. And preliminary results of these programs are really promising, with both participants and the staff who work at the programs reporting greater stability in the lives of participants, improved health, improved ability to address health issues related to drug use, mental health improvements and addressing chronic diseases, becoming housed and employed, improved or improving relationships with families and friends, and feeling safer with fewer interactions with drug dealers, street crime, and police. It's really incredibly positive. And of course, we know that access to safer supply, pharmaceutical alternatives, doesn't mean that all risk is eliminated. And there are those critics who say, there are some risks. Certainly, there are some risks of diversion, but it does mean that the risk of death or a drug toxicity event is significantly reduced. The goal of safer supply is not to promote substance use or encourage long-term substance dependency, as some would say, but it is to help manage the unmanageable risks of the illicit drug market, to provide stability and connection, and to support health and wellness. As I mentioned, there are concerns about diversion, which is certainly a concern with all prescribed medications, but there is no data supporting public harms from diversion. And I think it's really important that we that we all know that. We hear talk about diversion. We hear police talk about diversion. Our government in BC has walked back some of the policies around safe supply. People now have to come and use their safe supply prescription in the presence of a pharmacist, but it's really all based on information that has been hidden, information that has been gathered by police, information that they refuse to provide publicly. There is no publicly available data. There has been no research project around this, which I find very, very troubling. What we do know, in BC, the most common safer supply drug is hydromorphone, also called Dilaudid. Around 86% of the hydromorphone prescribed in our province is for pain, particularly people suffering from pain post-surgery or cancer. 14% is prescribed under the safer supply program. It has not contributed to the deaths. In fact, only about 3% of deaths in BC from drug toxicity involve hydromorphone. It has not been attributed, and no death has been attributed only to hydromorphone. We have not seen any increase in opioid use dependency since the initiation of the Safer Supply Program, particularly in youth, which is the big concern, that safe supply drugs are being peddled to youth. But the data doesn't show us that. The number of youth dying has gone down. The number of youth being diagnosed with opioid use disorder is decreasing. Those are the facts. Unfortunately, despite the promising results from the early programs, very few people can access safer supply in Canada due to the very limited number of prescribers available. It's a prescriber program. An expert panel in our province, stood up by the Coroner Service, recommended the establishment of a non-prescriber model for the provision of regulated pharmaceutical alternatives, safer supply, as a means of ensuring that across our province and certainly across the country, where we have many towns and communities that live in rural areas and can't access one of the smaller safer supply programs, could have access to a regulated supply that would keep them safe. Our government absolutely refused to consider it. It is not on the agenda, and I haven't seen it on the agenda in any province or territory in Canada. And I know you keep advocating for it, and it's fantastic. We need your voices. We need more voices. Before I wrap up, I want to mention prohibition and the criminalization of people who use drugs. Canada's Opioid Act was declared in 1908. That was the start of our drug laws, and it was enacted largely in response to anti-Asian sentiment. It is a racist piece of legislation. Over the years, it has been amended and revised and is now the Federal Controlled Drugs and Substances Act, and it makes possessing and selling controlled drugs illegal. It is not evidence-based. So for those who think that's, it has always worked in the past, and for some reason now is not working, it has never worked. It has never been researched. It is not based on evidence. There is no evidence to support prohibition as a meaningful tool in addressing the complex medical issue that is substance dependency. The criminalization of substance use has meant that the funds that could be directed to research, treatment, training and educating healthcare providers, and providing an evidence-based continuum of care to those experiencing substance use harms has gone instead to law enforcement. And for decades, law enforcement has received the lion's share of resources. Not only has this not had any positive outcomes for those experiencing harms related to substance use, it's made their situation so much worse. People who use drugs have been shamed, vilified, stigmatized, arrested, and punished, all because they are experiencing a complex medical issue that itself is the result of circumstances beyond their control. BC obtained a 3-year exemption. You probably all are aware of that from the Controlled Drugs and Substances Act, the decriminalization pilot started in January 2023. And that means it is legal in BC to possess up to 3.5 grams of controlled substances for personal use in specific locations, including private residences. Following concerns about drug use in public spaces, the exemption was amended so that drugs cannot be possessed or consumed in public, which is kind of a very awkward, as police have told me. You can be arrested for going to your house with your drugs, but once you're in your house, it's perfectly legal to have them. It's a very bizarre situation. Um, Very interesting to me. At the same time that we have been trying to advocate for a safer supply of substances in Canada, and there's been a real pushback around people using drugs. I would note that Canada, it cost Canada $19.7 billion in 2020 because of the related to the use of alcohol. Alcohol is by far the most damaging substance our country uses. And I don't know about your provinces and territories, but in BC, it is being promoted and expanded. Vancouver just added $1 million to their budget so people could consume alcohol at some of our public beaches. And the $1 million was to help clean up and police, which I find astounding because that mayor of that city was also adamantly opposed to public drug use. I could talk about that all day, but I will move on. So because of the decrim pilot here in BC, there's been a significant reduction in arrests for possession and of drug seizures, which is good news. Similar to many other places in North America, deaths due to drug toxicity have decreased. So decriminalizing, although people will say, critics will say that it is a failure in BC, it is absolutely not a failure. It is people are not facing the risk of arrest or punishment simply for personal use of drugs. Arrests have gone down, possessions have gone down, deaths have gone down. There have been no negative effects from decriminalizing drug use. Public drug use was a concern. Frankly, I think that was more related to the significant increase in homelessness we have in our province. Many, many people now living unhoused. I don't for one second believe that people who are housed were coming out in public and smoking their drugs on the street. That wasn't happening. What the public was seeing was people who are living unhoused, now feeling a little bit safer to use their drugs publicly. They can't do that anymore. So decriminalizing has done no harm in BC. It's a critical recognition that the challenges of substance use aren't best met with a punitive approach, but are best met with a health focus. And I'm sure many of you who have talked to physicians who treat patients with problematic substance use or substance use disorder, and they will tell you, I wish that the police and the government would just stay out of my business and let me treat my patient with medicine and the evidence that I know works. It's infuriating that can't happen. A good friend of mine addresses every difficult issue with a question: what is the problem we're trying to solve? And I would say with the current drug crisis in Canada, the answer is we want to reduce the harms to our family and community members that can stem from drug use. How do we do that? I'm not going to go A, I'll lose track. So I'm just going to start. First, we develop a robust, pragmatic education strategy that helps Canadians of all ages understand the risks and realities of substance use. It is astounding to me that this many years into this crisis, there is not a national, pragmatic prevention strategy designed with support from people with lived and living experience and their families. It doesn't exist. One of my children is a teacher, and there is nothing on the curriculum requiring them to teach anything about substance use or any of the information that we know about the harms related to substances. The old scare tactics of the past were not effective, but they have not substituted anything. We need to fund universities and researchers to address the root causes of substance dependency and how best to support people to wellness. Addiction medicine specialists, as they're known, are not seen as one of the desirable specialties in medicine, and that needs to change. In a time when we are losing so many of our loved ones to drugs, we need to focus on that kind of research and that kind of support. We need to fund a healthcare system that's accessible when people need it. People often turn to substances as a way to cope with their physical or emotional pain or trauma because the help that they are seeking is not available. We need to make sure that if people do use drugs, those drugs are as safe as possible. We don't promote or encourage drug use as was done with tobacco, still done with alcohol, but we recognize that if people are going to use substances, we do the best we can to minimize the risks. And that means drugs must be regulated and managed just like other substances with the potential to cause immeasurable harm, like the contents of any liquor store or any pharmacy in our neighborhood. Both of those places are full of things that can cause death, but they are regulated and there are dosages and there are recommended usages, and that makes them much safer. And of course, we need to decriminalize drug use. Punishing people for using substances has cost billions and has made a difficult and complex health challenge immeasurably worse. Instead of funding police, courts, and jails, we need to fund a continuum of care that supports health and promotes health and supports people to wellness. I don't have to tell you this. People who use drugs are us. They are our friends, our family members, our neighbors, our colleagues. We know that drugs can cause serious harms, and we want to do all we can to reduce those harms. Problematic substance use is a complex challenge, requires a thoughtful and nuanced approach. We need leadership willing to follow evidence and not hysterical populist notions from another century. So I want to thank you all. I'm so pleased to be here today, and thank you for advocating for an evidence-based, compassionate response to the substance use crisis. I have hope for a meaningful shift in our country's drug policy, although I haven't heard any talk from the new government about their approach to drug policy. I have hope that our new prime minister is the father of 4 daughters who are young, who will have friends who have experienced substance use challenges, and seems like a fairly open-minded, compassionate person who focuses on evidence. I have no doubt that history will show that the moms led the way and were right all along. And again, I'm just so pleased and happy to be here. And I'm happy to answer any question you have. Thank you.
That was wonderful. Thank you. That was so enlightening and educating. And we have about 10 minutes for questions. So if anybody wants to pop a couple into the chat, we can do it that way. Well, I have one to start you off. How's that? So you had mentioned it around treatment and that we're recognizing that they're not collecting data, which is really scary because I know here specifically in British Columbia, it's an unregulated industry. We'll call it an industry. But I do know from personal experience that in speaking with the coroner's office, that the questions that are asked up until that point, do you know what's happened in the last week, 72 hours? So that information is available. And is it just not part of the mandate to collect that data? And that's what my one question is. And the second one is, if we take somebody's who's in their medical, like MSP is paying for their treatment, that data can be cross-correlated as well, can it not? Like that's what I'm concerned. Like, how do we advocate to get this information? Because it is extremely valuable.
Yeah, a great questions, Tracy. And certainly the very first death review panel, which is where the coroner's service brings together subject matter experts to sit down. And we had the provincial health officer and all of all of the directors of the health authorities. We had the College of Physicians and Surgeons, police, Crown, education. And that was one of their main recommendations, was that, well, A, there needs to be a standard of care developed. What is the best treatment for somebody who's experiencing problematic substance use or substance use disorder, which are two separate things? Those standards don't exist. So first of all, there was a recommendation for standards. Those standards still don't exist. And that's why, as you say, there are private treatment centers. There are private treatment centers with publicly funded beds. There are not-for-profit treatment centers. Then there's the medication treatment, which is opioid agonist therapy or injectable opioid agonist therapy. But some of those things are tracked via your care card. In BC, it's called a care card, and that's your unique medical number that shows all of the prescriptions you get and all of the times you've been to a hospital. But they're not, the province does not track that. For some reason, the province is not collecting that data. So they aren't putting it into a data set. If you go to a private facility, they don't have, nobody's tracking that data. So we don't have any of that. So what the coroners can do is ask family members, has your loved one received treatment in the past? And sometimes family members know, and sometimes they don't, depending on, how much recent contact there's been with somebody. And sometimes they know what's happened recently, but they don't know 6 months ago or a year ago. So it's a really imperfect way of collecting data. We found that the best way for us to show patterns and trends around people who are dying of substances was to go to a data source. So for example, in BC, we have PharmaNet, and that tracks every medication you ever got. We can see that tracked. There's no data source for substance use treatment. It just doesn't exist. And I have no idea why the province isn't tracking that. I have no idea why it isn't mandatory, why every service shouldn't be required to use your care card, your personal health number, and somewhere collected by our Ministry of Health. It just isn't happening.
Because it seems it's not important to them to, sorry, to make it happen. It's important.
It's horrible to think that, but yeah, I just don't understand it.
Neither do I, but that's something to actually, to really look at further down the road. There's a question here from Jody, and it's, what is your stance on, we call it coercive care, forced treatment? And do you see the issues like a lot of us do, the concerns around that?
Yeah, so the research does not support coercive care as a meaningful treatment for people who are substance dependent, for a number of reasons. One being, as most of you probably know, if you love somebody who has used substances or is using substances, people need to be in a place where they want to change. And when people are not in that place, coercing them into treatment is not likely to be effective. And that's what the data shows. That is not just opinion. The data shows that forcible treatment is really not that successful in long-term meaningful change. And that's the other piece, is if somebody is in prison, basically their liberty is taken away from them and forced into treatment. What happens when they're released? All of the challenges that they experienced or the realities that they were coping with are still there and haven't, unless those have changed dramatically, isn't going to continue to support them to not use drugs. So that's one of the things that we've been saying. Let's first address some of the very basics. People have a roof over their heads, a place to live, food to eat, a basic income, and a safe supply of the substance they're dependent on. Let's start there. The real challenge is, if we're focusing on the very most difficult end of the spectrum, where people are already experienced significant damage, whether it's acquired brain injury or extreme physical health challenges because of substance use, incarcerating those people or imprisoning them for forced treatment just means that the whole big group at the other end of that if it's a river, for example, they can't even access voluntary care. Detox, huge lineups everywhere. We don't have standards for voluntary care. We don't know what's effective. They're just focusing on the wrong place. Certainly, there is a mental health act in our province, and if people are at risk to themselves or others, they can be arrested, and with signatures of 2 doctors, they can be held for a period of time with consistent review until they are well enough to look after themselves. That already exists. But the research just does not support involuntary care as an effective way to help people to wellness.
Yeah, thank you. That kind of answered Gina's question at the same time. I'm just scrolling through here to come up with one. Something that's more of a comment than any, there's a lot of comments in here, Lisa, saying, thanking you and so appreciative of your talk. But Charlana just brought up a comment saying government is calling for another review of the issue. What are your thoughts on that? And
I don't want to be too critical of government, which I tend to be, because of my frustration with the immensity of this crisis and the response, which has been nowhere near commensurate with the immensity of the crisis that we're experiencing. More than 50,000 people have died. In our province, there are estimates that 225,000 people use drugs. They're all at risk every single day from the street supply. Our policies support organized crime. We enable organized crime because people are dependent on substances, and you can't, this simplistic notion that people can just choose not to use drugs one day or the next. They can choose to want to move away from substance use, but it's a difficult journey, and it needs lots of support, and it needs lots of compassion, and the continuum of care that it needs just doesn't exist anywhere in our country right now. Another review, I think we don't need another review. We've got, in our province, we brought together experts 3 separate times, and they all said the same thing. If you look at some of the reports that come out from the Canadian Association of Chiefs of Police, the federal government's drug task force, the physicians, the public health officer's recent paper, there is consistent agreement that this is a health issue, right? Substance use is a health issue. Why don't we want people to use substances? Because it harms their health. So why do we respond with a law enforcement response? Why aren't we focusing on a health response? And that recommendation has been made over and over and over again. And honestly, I don't know why governments would need to do another review. They just need to go back to the experts that they've already stood up on multiple occasions and who have told them the same thing. Fix the health response, provide options, make sure access to the treatment that people need. And you can certainly look at safer supply as a treatment. It is moving people away from the toxic drug supply. And at very least, people would have access to pure drug, as opposed to all the adulterants that are put in drugs and that cause a lot of the brain injuries that we see amongst people who use drugs. In our province, there's an organization, Jeremy Calicum, one of your previous directors, DELF, Drug Users Liberation Front, started a small compassion clinic where they ordered drugs online, they tested them to be safe, and they sold them at cost to people who were at risk of death from drug dependency. And they had some support from the health authority until government shifted and raided the DELF offices, took the drugs, searched Jeremy's house and one of the other people involved, and charged them with trafficking drugs, and they are now facing criminal conviction for drug trafficking. And it's just infuriating. Once at a news conference, I was asked about my thoughts about that Compassion Club, and I just quickly randomly tried to think of something to say, and I thought, when you see people in a burning house, it's okay to break a window. And that's how I felt about their Compassion Club. They are seeing people die in the downtown east side, which is the hardest hit neighborhood in the country for substance use, they are seeing people die every single day. And we know that most people who use drugs and who die of drugs don't live in the downtown east side or some of our most vulnerable areas in the country. They live in just neighborhoods. Most people never see the majority of people who use drugs. They never know the people who are dying of drugs because they aren't in public view. There are families and our friends, and they're dying at home in their suburban homes and their rural homes and their urban homes, and they don't realize that all those people are at risk of death too. So I'm not sure. I think I went off on a tangent there,
That's
but
okay. We do it all the time. Just
yeah.
last question, and then we'll take a quick break after this one. There's so many that are keep popping up. So kind of roll this in. Actually, it's going to be two questions. We'll start with the first one is that we know that you struggled while you were in office with different perspectives. How has that affected the work you're doing now and at the time? That's kind of a personal one, but it's
It's a great question. When I retired, I was angry. I was very angry. Leslie will know that. Corinne will know that. And I was very frustrated because we knew what to do to reduce the harms. We know what to do to reduce the number of people dying. Our medical experts have told us, and government just refuses to do it. And honestly, I'm so disappointed in our government. We have a premier who was the head of Pivot Legal, all about civil liberties and people's rights, and now is focusing on incarcerating people purely because they are using substances. And it doesn't mean that people aren't harmed from substances. We all know they are. We definitely know that, and none of us want that to happen. But we need to use evidence-based means to help them to wellness. And we need to rely on our doctors. We have a group here, Doctors for Safer Drug Supply. They set up pop-up overdose prevention clinics. Leslie and I have been there with signs, and Corinne, of course, is a huge advocate for that. And they are so frustrated. They know how to treat their patients who are struggling with substance use, and they're not allowed. The law is preventing them from doing what they know is right. Your voices are incredibly influential. Moms, everybody has respect for their mom. When your mom tells you something, you listen. And so I think you are making a huge difference. And you go to Ottawa. I mean, you've spoken with the last prime minister. I think it makes a huge difference. And all I can say is keep raising your voices. And it also, seeing you pushes back against those stereotypes that somehow drug users are all people that don't matter anyway, which is the horrible stereotype that we're facing, which our government pushed for years and years and years, right? It was the war on drugs, and it was the war on drug users, and it was making people who use drugs look like bad people who are dangerous and we should all be afraid of. And we all know that's not true. So we just need to keep speaking up. And I've seen all your beautiful pictures of your loved ones, which breaks my heart. But people need to see that everybody who dies is a real person who mattered.